Beets are packed with nitrates, which your body converts into nitric oxide, or NO. Nitric oxide relaxes and widens your blood vessels, so oxygen-rich blood can flow more easily to your muscles during exercise. In short, beets can boost your endurance and improve performance by enhancing blood flow and muscle efficiency. But how much of this is backed by human research? And what kind of benefits can you actually expect from adding beetroot to your routine? Beetroot has been widely studied for its potential to boost athletic performance, particularly for aerobic activities like swimming or cycling. While the benefits are promising for some, they don't apply to everyone or every type of exercise. For recreational athletes, beetroot juice can enhance various aspects of aerobic performance, like endurance and efficiency. It may also help reduce muscle soreness and increase pain tolerance, allowing you to push through longer workouts. However, when it comes to high-intensity anaerobic activities like weightlifting or sprinting, beetroot juice doesn't seem to offer much of a boost. Interestingly, the aerobic benefits seem to be most noticeable in recreational or less active individuals, but not in elite athletes. Studies on elite cyclists, elite runners, elite sprinters, and elite water polo players show no significant performance improvements with beetroot juice. This might be because elite athletes already produce plenty of natural nitrates and NO, so additional supplementation doesn't add much. Beetroot also doesn't seem to benefit exercise performance in people with certain health conditions. For example, a meta-analysis of studies on patients with chronic obstructive pulmonary disease found no significant improvements in exercise capacity compared to a placebo. As for muscle recovery, beetroot's effects are inconsistent. It doesn't appear to speed up recovery in the first 48 hours after exercise. However, some minor improvements have been noted after 72 hours. In summary, beetroot juice can be a great performance enhancer for aerobic activities in non-professional athletes. However, it's not particularly helpful for high-intensity anaerobic workouts, elite athletes, or muscle recovery. Beetroot may offer some help in lowering blood pressure, particularly for healthy, non-hypertensive individuals. Meta-analyses of small studies suggest that drinking beetroot juice can lead to a modest reduction in blood pressure, averaging around 4 mm systolic and 1 mm diastolic. These benefits seem to be most pronounced when beetroot juice is consumed daily in doses of about 500 milliliters and for at least 2 weeks. However, the evidence gets more conflicting for people with actual hypertension. In hypertensive patients, a combination supplement containing beetroot showed no significant effects on blood pressure compared to a placebo. Even in pregnant patients with hypertension, beetroot juice failed to show any meaningful blood pressure reduction. And in adults already taking blood pressure medication, drinking a nitrate-rich beetroot juice for a week didn't lower blood pressure any more than beetroot juice with the nitrates removed. Interestingly, some research hints that beetroot's blood pressure lowering effects might not rely entirely on its nitrate content. This suggests there could be other beneficial compounds in beetroot playing a role, though this is just a theory. In summary, while beetroot juice can help reduce blood pressure in healthy individuals, it likely won't be as effective for those with established hypertension. So if you're managing high blood pressure, it's best to view beetroot as a potential complement to and not a replacement for traditional medications. Given beetroot's potential to lower blood pressure, researchers have explored whether it could also help support overall heart health. Unfortunately, the evidence here is pretty underwhelming. A meta-analysis of clinical studies found that consuming beetroot doesn't significantly improve triglyceride levels or other blood lipids compared to control groups. In a small trial involving patients with coronary heart disease, beetroot supplementation slightly improved some measures of cardiovascular function. However, these changes were likely not clinically meaningful as they didn't show improvement in any heart-related outcomes. So while beetroot might benefit blood pressure in healthy people, it hasn't shown reliable benefits for heart health in individuals with existing cardiovascular disease. Beetroot has also been studied as a potential aid for weight loss, but the results don't look promising. In one study, overweight participants who added beet leaf powder to their diet saw a small reduction in LDL cholesterol, but there was no effect on body weight compared to those following the diet alone. Similarly, a small study on overweight adults following a calorie-restricted diet found that drinking concentrated beetroot juice daily didn't lead to any additional weight loss compared to controls. In short, while beetroot may offer other health perks, weight loss doesn't seem to be one of them. If you're looking to tap into beetroot's benefits, beetroot juice is the way to go. Research suggests that drinking anywhere from 1/4 cup to 2 cups per day, roughly the juice from 1 to 6 medium-sized beets, is the most effective method. Beetroot gel has also been studied, but it's not something you can easily find on the market. As for powdered beet or beet leaf extracts, like those found in large bags or small pills, those haven't been as thoroughly researched, so their effectiveness is less certain. For those opting to use these powders, here's a rough conversion. 10 grams of beetroot juice is about equivalent to 1 gram of beetroot powder. This means that 1/4 to 2 cups, or about 60 to 480 grams of juice, translates to about 6 to 48 grams of powdered beetroot. Most combination supplements aren't going to contain enough beetroot to deliver real benefits, so a dedicated beetroot product is your best bet here. That said, there's some debate whether powders can even truly replace fresh juice. Processing it into a powder can reduce the nitrate content and other nutrients, making the effectiveness of powdered beetroot highly dependent on how it's made. If you want the best results, stick with freshly squeezed beetroot juice whenever possible. If you're planning to add beetroot to your routine, especially if you plan on using a lot, you may notice a harmless side effect: reddish-colored urine or stools. This is completely normal and nothing to worry about. A more pressing concern, though, is beetroot's high oxalate content. Oxalates are dietary compounds that, in theory, could increase the risk of kidney stones in people prone to them. That said, this risk is purely speculative. There aren't any documented cases of beetroot juice actually causing kidney stones. If you're concerned about it, a simple solution is to consume your beetroot with some dairy or even a calcium supplement. Calcium binds to oxalate in your gut, reducing the chance of them forming stones in your kidney. Overall, beetroot juice is backed by solid evidence for improving aerobic exercise performance like cycling and offering modest blood pressure benefits for healthy adults. However, it's not particularly effective for anaerobic workouts like weightlifting, and it's probably not going to have much benefit for heart health or cardiovascular disease. Finally, if you're considering using a powdered form, just keep in mind that it may not deliver the exact same benefits as the freshly squeezed juice. Hi, I'm Dr. Brian Yeung. Do you use beetroot? And what are your experiences with it? Let me know in the comments down below. And if you found this video helpful, please subscribe to the channel and leave me a like. Hit the notification bell if you want to stay up to date, and share this video with someone you know who use the info.